A midwife is a health professional who supports women during pregnancy, birth, and in the first months after birth. She also takes care of the baby in the first years of his life. The midwife is therefore the reference when you discover that you are pregnant, to prepare for your childbirth, breastfeeding, also throughout your fertile life and the menopause. Midwives are usually work as freelancers in hospitals and in clinics. If you are pregnant, contact the midwife in your town. She will guide you through this wonderful journey. In clinics, professional staff will suggest you tests to do. This is important for your early diagnosis and management of illness, such as gestational diabetes or infections, which, if left untreated, could be dangerous for your body and your baby. 2 ultrasound scans are also recommended during pregnancy. The first one in the first trimester, and the second, the so-called morphological scans, in the second trimester. If there are signs of risk factors, your obstetrician or gynecologist may advise you to have further ultrasound scans. In the first few months of pregnancy, you may have blood loss or menstruation-like pains. Go to the emergency department because they may be a threat of miscarriage, which, if caught early, can be managed and resolved. In terms of lifestyle and diet during pregnancy, it is recommended exercise, swimming, walking, yoga, and to avoid alcohol, smoking, and drugs. You can eat everything, washing fruit and vegetables under running water, and avoiding only raw and undercooked eggs, unpasteurized milk, and soft cheese. If you are not immune to toxoplasmosis, raw or undercooked meat and sausages should be avoided. During your pregnancy, you could attend birth counseling session at the local health advisory center to help you understanding how to recognize the signs of labor, how to manage contractions, when to go to hospital, but also to deal with breastfeeding and the first care for the newborn. We can help you to understand when it is advisable to go to hospital. As already mentioned, you should go to hospital if you have a lot of bright red blood loss. If the waters break, this is when the amniotic membranes break into the amniotic fluid comes out. The fluid is usually clear and transparent. If the membrane breaks before 37 weeks and the fluid is yellow, green or brownish and thick, you should go to hospital immediately. If it is clear, you can take your time. There may also be mucosis losses, sometimes thick and pink or brownish blood. This is called mucus heel. Do not be alarmed. It is a sign that labor may arrive soon, but there is no need to go to the hospital soon. In the last week of pregnancy, you may feel that your belly suddenly becomes hard and for a few seconds, especially in the evening after having made efforts. This is normal. They are called the Braxton Hicks contraction and serve to prepare the uterus and the baby for labor. As the days go by, these contractions become more frequent and sometimes more intense, but not painful, until they become the first part of the labor. The symptoms of labor are characterized by contractions that are irregular in duration and frequency, more intense and gradually more painful. At this stage, if the amniotic membranes are still intact, you can stay at home, rest, drink often, and if you want, eat. I also suggest you to move your pelvis to help your baby to get into a better position. You could also take a hot shower. The heat helps to bear the pain. When the contraction becomes more intense, longer, lasting about a minute, and regular, the birth is likely to be close. So, depending on the distance between where you are and the nearest hospital, leave to the hospital. As a guideline, if you need about half an hour to get to the hospital, and if it's your first baby, you might go to the hospital when contractions are every 10 minutes. If it is your second or third child, even earlier, when the contractions are every 15 minutes, because labor is usually shorter. At the hospital, they will visit you to see how far into the labor you are. They will monitor your baby's health and the frequency and intensity of contractions. Also, at this stage, I suggest you to drink and eat if you feel like it. Try to rest between contractions and change position often in order to find the most comfortable position for you. Usually, the most comfortable position are standing, laying on your back with your upper body forward your pelvis, crawling or squatting. The expulsive phase, the moment of birth, is characterized by the uncontrollable sensation of pushing. Follow your feeling and guide your baby along. In hospital, the so-called lithotomy position is often used, lying on the couch with your legs raised. If it is not comfortable for you, ask to change position. Many women prefer the squatting or crawling position. Immediately after birth, your baby will be resting on the chest and may try to latch on your breast. After the birth, you will feel the need to push again. This is the so-called secondment phase. When the placenta comes out, it takes a few pushes. It is not painful and you will feel something warm and soft. After about 2 hours, you will go to the recovery room. They will bring you the baby and you can start to breastfeed and rest to recover. Referring to breastfeeding, it is important that the baby has a correct attachment to the breast. Offer the breast when he opens mouth properly. The baby's ears, shoulder and hips should be in line and he should not turn his head to latch onto this breast. The baby should grasp the nipple and areola, the dark surrounding part. If the attachment is correct, the chin rests on the breast. The mouth is wide open, larger portion of the areola can be seen above. There is no popping while baby feeds and it is not painful for the mother. If you have any doubts, pain or difficulties, ask the midwife at the hospital for help. The breastfeeding mother can eat whatever she has always eaten, trying to have a healthy and balanced diet. Alcohol, smoking and drugs should be avoided. I suggest you to drink a lot, at least 2 liters of water per day, and to rest. For the child, to get in touch with the mother is essential. Carry your baby in a sling, breastfeed him, hold him in your arms. You can sleep with the baby as long as they sleep in a firm mattress. The parents are not obese and they do not use medicines that alter the sleep-awake rhythm or drugs. If you have any doubts about your child's health, you can contact a pediatrician or a health center.